going to look at the conduction system of the heart. This will include the normal anatomy of the heart as well as different heart conditions. Let's take a look at the conduction system of the heart. It begins in the right atrium with the SA node, or the sinoatrial node, also known as the pacemaker. From there, the electrical impulse will travel to the AV node, then to the atrioventricular bundle of His, to the bundle branches, and finally to the Purkinje fibers. We'll look in more detail at this in just a minute. This is an animation of the conduction system of the heart. You can view this in slide presentation mode. This is the pathway of conduction of the electrical signal in the heart. It begins in the SA node where it is generated, and the SA node is located in the right atrium. From there, the signal passes through the atria, which contract, and on into the AV node, or atrioventricular node, into the bundle of His, onto the bundle branches, into the Purkinje fibers, which then cause the ventricles to depolarize and contract. Things that you should remember about conduction are, number one, the action potential arises spontaneously at the SA node, and remember that's in the right atrium. So the SA node is the pacemaker of the heart, and its fibers have the fastest inherent rhythm. There's a delay at the AV node of 1/10 of a second, and we call that the AV delay. Because the fibers here have a small diameter, this is what causes the delay. The reason we want there to be a delay is because it allows the ventricles time to fill. An important thing to recognize is that the electrical impulse does not go straight from the atria into the ventricles. It passes through the electrical system. And the reason it does not is because there's a cardiac skeleton separating the atria from the ventricles. Atria contract from the top down, ventricles contract from the bottom to the top. The heart sounds are the sounds the heart makes as the valves open and close. The sounds are described as lubbed up with a pause. The lub is when the AV valves are closing, and it is loud and long. The dup is when the SL valves are closing, and it is short and sharp. We just talked about the sounds that a heart makes under normal conditions. Sometimes it makes an abnormal heart sound, and that is known as a murmur. Often it will indicate that there's a problem with a valve. It's not unusual to have a murmur in a child because their heart has thin walls that vibrate, and this sounds like a murmur. What is an ECG, an electrocardiogram, also known as an EKG? An ECG is a graph that shows the electrical activity of the heart, and it's important because it can tell you if you are having a problem with your conduction system. On the right is a graph of one complete cardiac cycle. I mentioned the term complete cardiac cycle. A complete cardiac cycle is a series of both mechanical and electrical events that occurs when the heart beats. There are two main phases, and they are known as systole and diastole, and we'll talk about those in just a minute. The cycle takes about 0.8 seconds. Two very important terms that we will be using and that you should know are systole, which is the contraction phase, and diastole, the relaxation phase. On the left is an electrocardiogram showing one complete cardiac cycle. This cardiac cycle is composed of the P, QRS, and T waves. On the right is the machine used to obtain this complete cardiac cycle. So what do systole and diastole have to do with a complete cardiac cycle? You should first realize that both the atria and the ventricles have a systolic and a diastolic phase. If you take a close look at this diagram, you'll see that atrial systole, or atrial contraction, occurs during and just after the P wave. Ventricular systole, or ventricular contraction, occurs during and just after the QRS wave. And during the T wave, you'll have ventricular diastole and atrial diastole. Let's take a look at a normal ECG to see what each of these waves means. When you look at an ECG, you'll be able to see three distinct waves. The first is the P wave, and this is the time of atrial depolarization, and it lasts about 0.08 seconds or 80 milliseconds. The QRS wave is when ventricular depolarization occurs, and it lasts about 0.08 seconds as well, or 80 milliseconds. The T wave, the last wave, is ventricular repolarization, and it lasts about 0.16 seconds or 160 milliseconds. This ECG strip shows a normal sinus rhythm. The heart rate is about 68 beats per minute, and we'll talk about how you calculate heart rate in a bit. There are periods of time on an ECG known as an interval, and there are 3 intervals you'll need to know about. The first is the PR interval, which is the time from the beginning of the P wave to the beginning of the QRS wave. Typically, it will last about 0.16 to 0.20 seconds or 160 to 200 milliseconds. Second is the QT interval, which is the time from the beginning of the QRS wave to the end of the T wave, and it lasts about 0.300 to 0.340 seconds or 300 to 340 milliseconds. The third interval is the ST interval, which is the time from the end of the QRS wave to the end of the T wave, and typically it's about 0.24 seconds or 240 milliseconds. Let's take a look at these on the ECG. The highlighted portion of this ECG is the PR interval. It is the period of time from the beginning of the P wave to the beginning of the QRS wave. Let's look at how you would calculate the length of the PR interval. As you look at this graph, one of the very small blocks is equivalent to 40 milliseconds. One of the large blocks, which is composed of 5 of those small blocks, is equivalent to 200 milliseconds. Let's look at the highlighted PR interval on the left side, the very first PR interval. If you count the number of small blocks, you'll see that there are 4. Each block is worth 40, so that first PR interval is equivalent to 4 times 40 or 160 milliseconds. Is this within the normal range? Can you look at this ECG tracing and determine the length of the QT interval and the length of the ST interval? Were you able to determine the values of the QT interval and the ST interval? The QT interval is 10 to 10.5 blocks long. Since each block is equivalent to 40 milliseconds, the value of the QT interval here is 400 milliseconds to 420 milliseconds. How long is the ST interval? Since it's 8 blocks long, you multiply 8 times 40 milliseconds, and that's 320 milliseconds long. There are many events that occur during a complete cardiac cycle. Let's take a look and see if we can coordinate and understand these events. At first glance, this can be overwhelming. Let me try and break it down and tell you what you should know about this chart. If you look at the very top, what you'll see is the electrocardiogram, and we've talked about that, and we've talked about the waves that are there. The second line is the heart sounds. The first heart sound occurs at the end of the QRS wave, and the second occurs at the end of the T wave. If you look at the bottom of this chart, you'll see that the first heart sound is the time when the AV valves are closing. The second heart sound is the time when the SL valves are closing. Now go on down to the second block where you can see a deep orange line. That indicates pressure in the left ventricle. What I want you to see is that when the pressure in the left ventricle is at its highest, that the volume in the left ventricle, shown in the graph below, is at its lowest, and that should make sense because when the pressure is highest in the left ventricle, it's contracting, and that pushes out the blood that's in the left ventricle, so the volume there should be at its lowest. As you look at the last slide, here are the things that I want you to keep in mind. You should know the names of the waves and what occurs in each. You should know the characteristics of the heart sounds. You should know when the heart sounds occur. You should know how are the pressure in the left ventricle and the volume in the left ventricle related. You should know that all 4 heart valves can be closed at the same time, but all 4 cannot be open at the same time, and you can see this in that graph. And in addition, I want you to think about this, and that is that about 70% of the blood in the ventricles is due to passive filling. Only about 30% goes in when the atria contract. Heart rate is the number of times your heart beats in a minute. The normal heart rate ranges from 60 to 100 beats per minute, and the average is 72 beats per minute. Bradycardia is a condition in which the heart beats less than 60 times a minute, and tachycardia is a condition in which the heart beats more than 100 times per minute. The prefix brady means slow, and cardia refers to the heart. So bradycardia is when the heart is beating too slow. The treatment for bradycardia is, in some cases, a pacemaker. A pacemaker is a small device that's placed in the chest or abdomen to help control an abnormal heart rhythm. Pacemakers are used to treat arrhythmias, and arrhythmias are problems with the rate or rhythm of the heartbeat. The prefix tachy means swift or rapid, so tachycardia is a condition in which the heart is beating too fast. There are three primary treatments for tachycardia: beta blockers like Inderol, the Valsalva maneuver, and the mammalian diving reflex or ice water to the face. This is the Valsalva maneuver. During this maneuver, you attempt to exhale with some force while closing off your airways. These rhythm strips show how bradycardia and tachycardia compare to a normal ECG. The term arrhythmia means without rhythm. Cardiac arrhythmias are abnormal heart rhythms. The way to detect them is by using an ECG. There are two types of cardiac arrhythmias, heart block and fibrillation, and we'll be looking at both. Let's look first at heart block. There are 3 degrees of heart block. They are first degree, second degree, and third degree. In first degree heart block, all the ECG waves are seen. The PR interval, though, is abnormally long, greater than 200 milliseconds, and the reason for this is there's a long delay in the action potentials getting from the atria to the ventricles. The treatment for this is to do nothing. First degree heart block is not important in itself, but it can be indicative of other conditions or disorders. How would first degree heart block look on an ECG tracing? If you look at the green ECG on the left, you'll see what a normal PR interval should look like, less than 200 milliseconds, and usually between 120 and 200 milliseconds. If you look at the tracing on the right, you'll see that the PR interval is abnormally long. In most cases, these PR intervals are about 2 full blocks long, and each block is equivalent to 200 milliseconds. So 2 of those would mean a total of 400 milliseconds for the PR interval. The reason this is first degree heart block is because the PR intervals are greater than 200 milliseconds. Second degree heart block is not as easy to understand as first degree heart block, in part because there are 2 kinds. The first is called Mobitz type 1 or Vinke-Box block. The electrical signals are delayed more each time the heart beats until it actually skips a beat, so the PR interval will get longer and longer. With Mobitz type 2, the pattern is not as regular as it was with type 1, and some signals will move normally from the atria to the ventricles and some do not. So the P waves are fairly evenly spaced, but the length between them does not get progressively longer as it did with type 1. In both cases, some action potentials will not reach the ventricles. There are 2 primary treatments for secondary heart block, and they are atropine, which is a drug that will decrease parasympathetic input, and a pacemaker. This is second-degree heart block, Mobitz type 1, and what I want you to notice here is that the PR intervals continue to get progressively longer. This is another example of Mobitz type 1, and again, you should be able to see that the PR intervals are getting progressively longer. This is second-degree heart block, Mobitz type 2, and what you should notice here is that the PR intervals are not getting longer. If you look, there are 6 P waves in this ECG tracing, and they are all about evenly spaced. This is called a 3-to-1 block because there are 3 P waves for each QRS complex. This again is Mobitz type 2, so the PR intervals are not getting longer, and you should be able to see that the P waves that I've marked with the arrows are about evenly spaced. Again, this is Mobitz type 2, and what you should pay particular attention to in this case is the even spacing of the P waves. Third-degree heart block is also known as total or complete heart block, and it occurs when the electrical impulses that are generated in the SA node, which is located in the atrium, is not conducted to the ventricles. When this atrial impulse is blocked, an accessory pacemaker in the ventricles will be activated and cause a ventricular contraction. So, no action potentials reach the ventricles. Another part of the conduction system takes over and becomes the pacemaker, and you can see all waves, and the PR interval is not constant. The reason for this is there are 2 separate pacemakers that are not coordinated. One that stimulates the atria, one that stimulates the ventricles, and they are not coordinated with one another. The treatment for third-degree heart block is a pacemaker. When looking at an ECG tracing for third-degree heart block, there are two things you should watch for. The first is the P waves. Note that they are evenly spaced from one another. The second is the QRS waves, and again, note that they are evenly spaced from one another. What you should also note is there's not coordination between those two sets. There is not one QRS wave for each P wave, and this is typical of third-degree or total heart block. So again, this is third-degree heart block, and that means that the P waves are evenly spaced, the QRS waves are evenly spaced, but there's no coordination between the P waves and the QRS waves. The second type of cardiac arrhythmia is fibrillation. Fibrillation is a condition in which the heart quivers and does not beat, and there are two types, atrial fibrillation and ventricular fibrillation. Atrial fibrillation is a condition in which the atria quiver but do not beat. It is not a lethal condition. It should make sense that if you look at the ECG, there would be no P waves. There are QRS and T waves, but they are irregular. The treatment for this is drug intervention. Remember, this is not lethal because 70% of the blood that goes into the ventricles moves there by gravitation. The other 30% is pumped by the atria. Again, this strip shows atrial fibrillation. Notice the distinct lack of P waves and the irregular distance between QRS waves. Take a look at the difference in a normal ECG as compared to an ECG of someone with atrial fibrillation. Unlike atrial fibrillation, ventricular fibrillation is fatal within a few minutes if it's left untreated. The problem is there's a loss of contraction coordination in the ventricles, and remember that the left ventricle pumps blood to the rest of the body. The ECG is random when you look at it, and the treatment for this is defibrillation or an electrical shock. This is an ECG in someone with ventricular fibrillation. You'll notice the lack of any distinct waves. Now take a minute to compare atrial fibrillation, the lack of P waves, with ventricular fibrillation, which is the lack of any distinct wave. You can see what happens to the pattern in both atrial and ventricular fibrillation once defibrillation occurs.